Okay, this is Jacob, and he has his cup on and his little donut collar on. He has gotten his cup very dirty from playing outside, and the donut collar, the white strip of tape, is because the Velcro strap keeps coming undone. So anyhow, we're going to go over how to clean Jacob's ears on a daily basis. If you come in closer, you can see the stitches along the edge, and they go all the way up. And you notice the tip of the ear is exposed to the air. Later on, when you start taking stitches out, you start taking the top ones out first, and then a day or two later, take the bottom ones out. And stitches come out in about 10 to 12 days. There. To clean your ears, you need your chlorhexidine, which you dilute with about 2/3 water to 1 part chlorhexidine, and use warm water. You need some gauze pads. Don't use cotton. The little cotton threads get stuck in the ear. You need Q-tips. You need antibiotic ointment. And if you can get it, you need sulfa powder. Take your gauze and dip it in the solution. Wring it out. And carefully, along the cropped edges, clean. And you want, where scabs have accumulated on the stitches, get them off, pull them off. Clean it well. When you have gotten the outer edge, dip your Q-tip in some of the solution and gently clean the inside of the ear. The yellow that you see is actually the antibiotic powder that was put in the day before. And once the ear is cleaned, you can go ahead and put a little bit more of the antibiotic powder in the ear. Just gently sprinkle it in. It tickles, so they don't like it. And on the edges, put a very, very light layer of Neosporin along the cropped edges. Very light. If the edges are looking a little bit moist, discontinue with the Neosporin ointment. Okay, want to flip them to the other side? And repeat the procedure, getting a new gauze pad. And again, once that's done, put a little bit of powder in. A little bit of ointment. Also, when you're doing this, just make sure you're checking the ear, making sure that the healing process is going on well, that there's nothing that looks inflamed. Check underneath their cap to make sure they're not getting any sores. Just run your finger under there, make sure it's not moist or crusty. If it is, you'll need to replace the cap. Also check to make sure that the collar's not rubbing on their neck anywhere. And the puppy is done. And for his participation and being a good baby, he gets a cookie, which is really a piece of kibble and he's not that excited about. And that's it. Ears should be cleaned once daily and inspected at least twice daily. That's it. Thank you.